Hi, my name is Lerone Lazenby from Sheq Risk Partners, a registered and accredited first aid training provider. I'm also a mom of two, and as a mom, you know that you are usually the first responder to any medical emergency for your baby, infant or child. That is why today we're going to discuss some of the basic principles of first aid, including your primary survey as well as CPR. CPR stands for cardio, your heart, pulmonary, your lungs, resuscitation. Should you come across an unresponsive baby in their crib or after tummy time on the floor, our first step is always to check baby's responsiveness. You can do this by slightly tapping them on their foot and saying, "Hey baby," or on their shoulders, "Hey baby," or you can slightly pinch their earlobes, slight pinch, in order to check if they wince. That is an indication of responsiveness. The next steps is our primary survey. For primary surveys, we follow the ABCs. A stands for airway. Putting your hand on your baby's forehead and your fingers under their chin, you slightly tilt up their chin and their head back to open their airway. You can open their mouth and check if there's any obstructions in their mouth or nose, and if there are, you can pick that out now. B is for breathing. To observe baby's breathing, we look at if their chest and their tummy is rising and falling like it normally would when they are breathing normally. We can also bend down and feel with our cheek by their mouth and nose if we can feel breathing. If baby is gasping, that is a sign of abnormal breathing and might mean obstruction in their mouth or throat. C stands for circulation. This is when we use two fingers on the side of baby's neck to feel their carotid artery and determine if they have a heartbeat. You can try this on yourself now. Try and find your carotid artery and feel your heartbeat. And that is the ABCs of your primary survey. If after your primary survey, baby is still not responsive, is not breathing or is not breathing normally, or you are struggling to find a pulse, that means that baby requires intervention. Our first step is to phone for help. You can phone a private or government ambulance service. If you are alone, use your cell phone on speakerphone to phone for help. The first step is to make sure that baby is lying on a flat surface. For babies, we start with initial 5 rescue puffs or rescue breaths. To administer rescue puffs, take a deep breath in. Tilt baby's chin up and their head back. Place your mouth over their mouth and nose to make a seal. Administer 5 short puffs of about 1 second each. In between puffs, take your mouth off of their mouth and nose and watch the chest rise and fall before administering the next puff. The next step is chest compressions. To administer chest compressions for baby, you will use 2 fingers placed in the center of their chest. When you administer chest compressions, you have to press down 1/3 of their chest in order for the compression to be effective. We administer 30 chest compressions at a rate of 100 to 120 beats per minute. This is quite fast. After the chest compressions, you will administer an additional 2 rescue puffs. Make sure to tilt baby's chin up and head back. Place your mouth over their mouth and nose to make a seal and administer a puff per second. In between puffs, take your mouth off and watch their chest rise and fall. You then continue with another 30 chest compressions. If you are unable to call for help, you have to continue with 30 chest compressions and 2 rescue breaths for at least a minute before you go and find a phone to call for help. If you have to move to get to a phone, take baby with you. If at any point in time during your chest compressions and rescue breaths, baby becomes responsive, you can wait for medical assistance in order to verify if baby is fine, or you can ask someone to take you to a hospital or a doctor so that they can have a look at baby. So remember, when you find baby unresponsive, we check for responsiveness by tapping them on their feet, their shoulders, or slightly pinching their earlobes. Then we go over to our primary survey ABCs. A is for airway. Tilt their chin back, open their mouth and check for any obstructions in their mouth or nose. B is for breathing. Observe if there's normal breathing and the rise and fall of baby's chest and stomach, or bend down and feel if there's breathing against your cheek. If baby is gasping, this is not normal breathing. The next step is to check for circulation. Can you feel baby's pulse when you feel by the carotid artery? If any of your primary survey is not intact, this means that baby needs intervention, and we will start with CPR. CPR starts with 5 initial rescue puffs, followed by 30 chest compressions with 2 fingers in the middle of baby's chest and pressing down a third of baby's chest for a compression to be effective, followed by 2 rescue puffs. And you would continue with that cycle until help arrives or until baby becomes responsive and you can take them to a doctor or the hospital to have them looked at. Thank you for watching.